Hi everyone, for anyone who tuned in today, I'm Yi Kang from the Activities and Events team of Welfare Task Force. For anyone who are not familiar with the Welfare Task Force, it is a student-led organization for students who are studying abroad to better support each other as a community, especially during these challenging times and even a post-pandemic period. Today, we are glad to have Colin Wong and Yi Kang to share with us their recent situation and how they are coping with the new normal in Northern Ireland during this tense chit-chat session. If there are any questions, please leave them below in the comment section. Now let's welcome them. Hello, Colin, Yi Kang. Would you guys to introduce yourself before we start?
Hi everyone. Maybe I will start first. So, for myself, I'm currently a final year student studying in Queens, and then very glad to be able to join this session, and then hopefully I'll be able to kind of share my own lockdown experience and what kind of support students can get in Queens. Yeah, maybe up to Colin.
Yeah, I'm Colin. So graduated from Queens in 2016 and working as a pharmacist in Northern Ireland at the minute. Yeah.
So it's quite nice. Three of us are all from Queens. So yeah.
Yeah, Queens team.
So firstly, let's start. So the most important part is, may I know what is the current situation like in Northern Ireland in terms of social distancing measures and policies?
Maybe Colin, maybe you can.
Well, me. So basically, at the minute, I would say it was kind of calmed down a little bit at the start, at the middle, probably July or sort of. But since last week, it has been, there's more cases coming up. Well, I would say it's the same for the whole world, everywhere. But in terms of the lockdown, the social distancing, obviously everywhere there'll be 2 meters apart. Even though in the gym, or in shopping center or any Tesco, before you go in, there's always the limited the amount of people in the shopping center at the minute. So there will be there will be 2 meters apart for everybody before you go into the shop. And even though during the queue there will be 2 meters. I know even in Malaysia it's only 1 meter, but in the UK they put in 2 meters at the minute.
And I think also recently mandatory to wear face masks as well, when you go to.
Yeah, it is. So basically from 10th of July, it is mandatory to wear a mask in public transport. So whoever's going on to a bus or train, anything like that, public transport or tubes underground, you have to wear a mask. But from 10th of August in Northern Ireland itself, you have to wear a mask even before you go into the shop. So we have whoever working in the shop has the power to refuse you, to serve you. They can ask you to go out if you don't want to wear a mask. But at the minute, I haven't seen any people got chased out yet. So at the minute, I've seen everybody seems to be, coping well. Of course, you see 1 or 2 people that doesn't like wear masks. So there's some exemption for whoever don't. Well, the exemption of the health conditions. So it's not like everybody has to wear a mask. There's some people if you have asthmatic, if you have this, if you have that all the information you probably could find them on the NI Direct. It will show everything up there. Yeah.
And I think also as a student, so recently they also sent us getting Queen sent us that email to update us on the recent policy, face mask policy and everything. So we will also recommend anyone including returning students or even prospective students to check your Queen's email. Maybe you will get what Colin said, the details and everything in those emails. And I think generally it's safe. Everyone is trying their best to follow the.
Yeah, it is safe. So it's not as bad as what you see on the news. So.
Yeah.
All right. So, how have you guys been coping or spending your time during the lockdown period? I know you guys are staying over there, right?
Mm-hmm.
Yes.
So how you guys spend your time?
So as for me, the entire lockdown start at the end of March. That's when everybody start panicking, and I'm sure all the students flying home at that time, like when the Boris Johnson say it herd immunity, I would probably go home as well, but I couldn't go home, so I have to work. But at that time, I've already booked 2 weeks off at that lockdown period. Not that I deliberately booked that 2 weeks off, but I was just happened to be booked that 2 weeks off. So at that time, you can see on the street, everybody's panicking, stockpiling unnecessary stuff. And even though myself working in chemist in a pharmacy, people has been stockpiling medication. They ring the doctor for more medication because over in the UK, yes, you get your medication through a prescription. So you're not just walk into chemist and buy your medication. Not like Malaysia, you can go in there and say, I want such, and then you just pay the money and that's it. But in the UK or Northern Ireland, it will be mainly based on prescription. So if you need a medication, you have to get them from the doctor. So that's why at that time everybody's panicking for lockdown. You're not allowed to go out, so people start stockpiling. So the entire time during the lockdown, I was off that 2 weeks, and then when I come back, everything is like the place like got bombed. It is like a disaster because it is so much things to catch up. Everybody's panicking, doesn't know what's happened. But for me at that time, we just have to work. I don't count myself as we're frontliner. Yeah, we're frontliner as in because the GP surgery or the doctor's surgery clinics, they're closed for public. So they're telling the patients, if you need medication support, anything else, go to your pharmacy, which is wasn't very nice at that time because then everybody will come in.
Flock in then.
Yeah, flock in, and then the shop just pack of people, and which means it's increased the risk of cross transmission as well. So, but up until now, we all coping very well, and the work's done, and yeah, it has become a new norm. I have to say, it's busy, but it's a new norm now, so we just have to cope with it. And yeah, basically that's it.
I think it's also quite cool, like to be able to hear from Colin, because like for myself, I'm still like studying, and then probably during the lockdown, the only
you probably just stay at home.
is at home, or maybe like even my work is usually like online. So it's very nice to hear like how the like frontline, and also maybe even in the pharmacies, how they're actually coping with the COVID situation in Belfast or in Northern Ireland. Like for myself, like I think quite similar to other students, basically staying at home. And then we got, I think, quite a few virtual experiences. I think because of this COVID, there's actually a lot of new opportunities available for students. So there's now increase of webinars, increase of virtual internships for students. So I think those are something that I actually use to spend my time, and also volunteering for the welfare task force as well, just to support students. And now, like, I think the university is also starting to reopen. So I just came back from work in the uni. So some services, especially like in the student guidance center, and I think in different departments of the school, so they are starting to reopen. Of course, it's only just for like essential services. If you want to like submit your thesis, or if you have any questions, that is very important, and you can't actually do that online. So I would say, like what Colin mentioned, like the whole city and everything is starting to get better, and then university is also going to open. So I don't think that's a lot of problem. And I wouldn't say I enjoy my time fully staying at home all the time, but it's a very new experience. It's definitely
you can watch different dramas every day. So
I finish so many dramas.
So for Colin, do you feel afraid like working at the front line?
I have to say at that time, I don't think I'm afraid, but I'm sort of worried that what if my colleagues got them, so then if my colleagues got them, then I will be affected, then everybody will be affected. So it will be like the whole shop, you have to be closed. Then you'll be like no service given to the public. So what if that happened? Then it's like a rolling ball. So one mistake or one issue, it will just keep rolling and get everybody into that situation. So that time, and basically, I wasn't that worried because then if you wear a mask, yes, obviously a mask is a big deal. If you're wearing a mask, it should generally be fine, and wash your hands, just follow the rules, like because obviously we in Malaysia, probably in Asia country, you're just probably quite young, but at that time I have experienced SARS. So that time it doesn't hit Malaysia, but still at that time I remember that everybody's wearing masks going to school or anything. But wearing masks has been like one of the culture. But over here, obviously it's not a culture, but so it's quite a hard time to try to convince people, even though my own colleagues, to put on masks, like why should we wear masks? And so at that time, it's most of the time, that time would be
I can imagine it's like probably challenging, but not like very.
yeah.
I think it's like fearful and everything, but it's just new challenges that you will need to kind of.
Yeah, because then if you wear a mask, obviously you can't hear people. You realize how often we actually lips reading.
Yeah.
So if I'm wearing a mask now, yeah, you probably can hear me speaking whoever I'm talking now. But see, whenever you're trying to talk to a customer, if you wear a mask, they're wearing a mask, you hardly hear them.
Yeah, it's very difficult.
You'll be realizing how often you actually lips read the person rather than listen to what they're talking. So it's a big challenging, even on the phone, like the phones keep ringing all the time and everybody's just panicking, looking for the medication and things like that. And yeah, and also the public health agency in the UK has been providing PPE as well. So even though, so they're providing face mask, a flu repellent mask. So if you're seeing any face mask on the street, it says orange color. Yeah, they're working in chemist or they're working in healthcare sector. So, and then gloves. Well, personally, don't really recommend wearing gloves unless everybody's wearing them, because then you'll be contact with disposable gloves. Once you contaminate it, it brings everywhere. Even though you didn't, because if you're wearing gloves, you don't wash your hands that often. So at that time, we're more encouraging the colleagues or our staff to wear masks and wash your hands maybe every 5 minutes if possible, and then wash them for 20 minutes. And hand sanitizer, at that time, we keep some stock for ourselves, even though, you have to sell them to the public, but keep some stock for ourselves, then for us to use in the workplace.
All right.
Yeah.
According to WHO, right, there are more young people getting affected by that virus. So what I want to ask is, Colin, how can the people, especially students in Northern Ireland, get their medication or medical support in general?
So basically, if you have symptoms, if you start showing up symptoms, it will probably if you have to just to ring your own GP. I'm sure all of you have been registered to University Health Center. So there will be a doctor there all the time. So just ring the reception. First thing they'll tell you is self-isolating for 14 days. So so within that 14 days, if your symptom resolve, it normally take 10 days to resolve. So if that doesn't get any better within 10 days, or worsen symptoms got bad, and what you need to do, basically just ring a doctor again, go get tested. Well, everybody's eligible to be tested in Northern Ireland, so it's all free testing. I got tested for myself as well, because back in, I think it's July, I was coughing really bad. So I started worrying, because then what if I caught the virus? And then I went and get tested at the MOT center. It's like a drive-through. So thank God the result come back negative. So the test wasn't very pleasant, but it's something that you have to go through. Yeah. But in terms of the medication, you ring the doctor probably tell you to, to rest and stay at home. If anything happen, ring 111, because they want your support people. So if you ring 111 and everything's they'll guide you through the conversation, and they'll let you know what needs to be done in the next how many days, in the next how many hours, and they'll keep in contact. And the other thing is, then through that, even though like medicine wise, I don't think the doctor will probably write you a script at that time. If you have the COVID, it will be through your doctor and through 111, if you have test positive, then you'll be straight to the hospital. But in terms of other type of medication, you can just, ring on doctor, get a prescription, or even go in the chemist and buy some, over-the-counter medications like that. Yeah.
Yeah, I think it's just very different. I know there's a lot of rumors saying that it's quite hard to get medicines, and then the UK government is giving up on us and everything. But I just think that like what Colin said, you can definitely get the support. It's just very different compared to how we go to clinics and how we actually get medical support back home in Malaysia. So it's different. As long as you learn how and you get the numbers, you know how you can actually get support.
So make sure I'm sure all the students, so make sure you know your own university health center phone number. So anything happen, ring them. Yeah, you should be able to get them. Even trying to Google, say QB University Health Center, it will be a number there. So just ring them, ask them what's need to do, and if you need help, they'll probably put you through a doctor and go through a conversation with you. And if you need an antibiotic, yes, then you can go and get your prescription and go to the closest chemist. And this one is 𝗓𝗵𝗔. So I'm sure that's where every student go, because it's the closest. And you go there, get your medication, go home. That's really it. Yeah, pretty straightforward.
So from the comments below, what people asking, as UK has the EAT scheme right now, do you feel safe to go dining in restaurants?
Well, I've been dining since start of August. Yeah.
I think it's quite okay. Even though it's a lot of people, but then a lot of restaurants, they have the proper kind of I think plastic sheets, prospects, just to make sure there's social distancing available in the restaurants. And I don't think they are also accepting a lot of people into the restaurants, so they have kind of their own regulations in place just to keep everyone safe. And so I don't think we don't really want to comment on this. It's definitely very different back home in Malaysia. People if you learn about the EAT scheme, people will think that you guys are very brave and everything, but it's just different concerns, and then and everything. But
even in Malaysia, everybody's EAT as well, so it doesn't make big difference saying that we're risking our life or going out for dinner, but it has been regulated quite good and
quite worth it.
It is a thing to just help each other. So we have to, the restaurant needs to keep open, but what if they don't have customer? So the UK EAT scheme at the minute is the government sponsor half the price of the things. So they'll go in there and have our meal with the half price. So basically it is a good thing for us as well, because we're sick of cooking. So cooking for 3 months, I have literally out of idea what to cook already. So don't blame me.
The retail and the hospitality industry has been suffering. So I think basically a good scheme.
Yeah.
For Yi Kang, so what kind of support is available for students who are currently still studying in the university?
Okay, so I think I think this question is also very relevant for students who are actually coming in for their first year. I think they are very worried will they get their support. So I would say you get a lot of support. So in terms of the university itself, you can actually apply for a student hardship fund. So if you are kind of financially affected during the whole pandemic, you can actually apply for that. It's very simple. You go online, just search student hardship fund, and then they will teach you what kind of information you need to provide, and then they will get back to you to say how much fund they will be able to provide you. And I think now you can also get well-being services. So if you're mental health, if you're kind of mentally worried and everything, you not only can get I think free online appointments through their well-being services. Now they are also reopening the face-to-face appointments in the student guidance center, but definitely it's a limited kind of services, so you probably will need to book an appointment as soon as possible. But those services are still available for students. And then since what we have mentioned, now face mask is mandatory in some places, you can also get free masks in the student guidance center. So you can just pop in and get some free disposable masks. I think starting from 31st of August, you can also get free masks in the student union center. So these are all available for students. I know both in different Queen's accommodation, you can also get free masks over there. Then in terms of so if you're a Malaysian MSSNI, which is the Malaysian Social Society, currently we also have our own COVID Care Fund. So I think basically we managed to get some support and then fundings from external parties, as well as personally from the society, we kind of managed to get some funding. So the COVID Care Fund, basically, if you are equally financially affected, you can just submit a form through us. And then you will eventually, if it's okay, then you will basically get like £10 Tesco vouchers just to kind of support your groceries and everything. And also you can get free health packs from us. So I think these are all sponsored by the Education Malaysia. So you get like masks and sanitizers from us. So if you are an incoming student or returning student, if you need those support, you can always get in touch with the society. And we also have like a COVID care line. Basically, if you are worried of anything, if it's like mental health specifically related, we can't provide the advice. You will probably need to get go to your GP or go to like the proper well-being services on campus. But if it's just something general, you can always use the care line or just DM our page, the MSSNI page, and you can get the support. And then I think the last thing is, so I think it's just a lot of support being available. The last thing is also, if you're coming back and then if you really need to quarantine, at the moment, MSSNI is also working with the welfare task force. So we basically have the app. So it's like we call it the spare hand app. So volunteers can register on the app, and then you can also tell us if you need any support. And then the app will actually kind of like match you guys to the support required. So for now, basically, even though you need to do mandatory quarantine, you basically can still get your friends and also to do help you to get your groceries, or even yourself. If it's necessary, you can also wear a mask and then get your groceries. But if you really, really need support, you feel like you want someone to collect from you and then you don't have anyone to help you with that, you can just get in touch with us. And then we can also provide the support for you. So that's the series of support that is available for students. So I think we are all quite fortunate. Right. I know in different universities, maybe not that kind of supported, but basically,
but Queen's did a good job on it.
Yeah. So don't worry about that.
I think I've seen the question about somebody asked a question about racism issue. Yeah. But as far as I've been working in the public for so long, haven't been any racism issue at the minute. So even though people see wearing masks, I know you've probably seen the news in London that people got attacked for wearing masks, but I have to say not in Northern Ireland. Everybody's so nice, friendly, and considerable. So yeah, they probably keep a distance from you, but they're not go and approach and hit you or anything like harm you. But I have to say, we're lucky.
Just be sensible, Like I think during these times, everyone is frustrated, everyone is worried. So just don't like trigger people. And if you feel triggered, just walk away. Like try to be reasonable and sensible in this kind of situations. But for me, I don't think there's any racism kind of issue.
No, I haven't faced any. Even though I'm working with the public every day, no, I have to say no for that question. So you'll be fine coming home. Coming back to Belfast. Yeah.
Colin, so are there any adequate supplies of face masks, sanitizers, gloves in your region?
Yeah, well, so face masks at the start, it's been, what happened is at the start, we always have enough face masks, but what happened is at the start of the lockdown, a lot of students bought them, sent them back home. That's what caused the shortage in Northern Ireland or the UK generally. So, but at the minute, the face mask seems to be sufficient supply. Obviously, if you need any face mask, you can contact me. I can try to supply. Well, yeah, you have to pay for the money, as I'm not supplying for free anyway. So I can get it for you, and then you can just buy from me as well. There will be some discount for myself as well. So I'm not that I'm selling, but it is like if there's anything that you need, like any medication, like tablets or anything, if you can't get them, or if you have a problem, don't want to go out or anything like that, you can always contact me and I'll try to sort it for you. I think about face masks, I'll probably I think there's a question about bringing face masks home from Malaysia. I'll highly recommend that, and because yes, face masks you can buy them here, but it's quite pricey. It's quite cost bit money. So you have to think that pounds and ringgit, there's still five times difference. So as far as I heard, that Malaysia is selling a box of 50 masks for 50 ringgit. So I'll maybe try to get 4 or 5 boxes will be sufficient.
Yeah.
And face mask is not heavy, so yeah. But the other thing about hand sanitizer is, yes, you can. It's up to you if you want to bring hand sanitizer. So you can always buy them over here. Yeah, but it's price different. But I know hand sanitizer is heavy, so you probably need to bring more food on your luggage rather than just hand sanitizer. So you can probably bring a couple of bottles, maybe 2 or 3 bottles of hand sanitizer, just enough for you to use. Yeah. But they can be supplied, they can be bought in the chemist or anywhere.
Yeah, in general, like don't need to worry lah. Like you can, if worst to worst, you can still always get like some supplies from the university or from the society as well. So we also have some free supplies for students. So
Yeah.
Any other advice you guys give to returning or prospective students planning to travel to Northern Ireland?
I think it's probably the last question, right? Yeah. So sorry, Colin. So for me, I think basically it's just as Colin and I kind of try to kind of mention, is just don't worry too much. Sometimes there may be some rumors about how situation here is like, but I would just say be sensible, be reasonable. Just bring anything that you would think they'll make you feel safer over here in Belfast, and then just bring it over here. And then once you are on campus, if you need any support, you can always get in touch with us. And also we have Colin here today. So if you really need any kind of advice, if you don't really sure how can you get the medicines and everything, you can also get in touch with Colin. But we are always here for you all, so don't need to worry. And then we look forward to see you back on campus.
Yeah. But the other thing is, I have to say, when you arrive in Northern Ireland, there is an app that you could download. What is it called? Is it called Stop COVID-19? Yeah, it is a good app to download. Yeah, it probably use lots of battery on the phone because it's constantly running at the background. But it is good apps that to keep tracing. Yeah, I think you're using it. Yeah,
something like this. So basically, you need to switch on the Bluetooth, and then it's very easy. So people who have COVID and everything, they will just put in their data, and then if you switch it on, they will notify you if you are kind of in close contact of someone who has COVID. So yeah, this is our tracing app.
Yeah, it is a good idea to have that. So.
Okay. It's probably gonna end the session. So I'm very appreciated that Colin and Yi Kang have shared their experience today. I believe the session has probably given some useful tips and information to our fellow friends out there. And there are also more welfare polls and senior sessions coming up. Do check us out on our social media for more details. And once again, thank you, Colin and Yi Kang, for joining us today.
Yeah.
Stay safe, guys, and see you later.
Okay. Yeah.
Okay, see you.